Hello, my name is Abdurrahman bin Abdul Majid. My metric number is CD210200. Today I will present for the introduction of hyperthermia therapy. Hyperthermia therapy is a treatment that heat tumor tissue to 40 and 45 degrees Celsius to enhance the effectiveness of the chemotherapy and radiotherapy. This process increases blood flow to the tumor, making cancer cells more sensitive to treatment while sparing normal tissue. This study goal is to investigate how tumor size and configuration for the single tumor and multiple tumor affect the heat distribution during the hyperthermia using computational fluid dynamics. Why this study is matter? Because to understanding how heat behave in different tumor size and arrangement, we can optimize the treatment plan, ensure the better targeting of tumor and reduce damage to healthy tissue. So for the methodology, we decide to do 4 geometry, which is the first is the single tumor with 2 cm, single tumor with 4 cm, the third is the 3 tumor with 2 cm and 3 tumor with 4 cm. So for the meshing, we are using the tetrahedral element to accurately represent the tissue structure, which with a mesh of size 0.002 mm with high resolution. So for the governing equation, we're using the continuity equation to ensure the mass conservation in fluid. It states that the amount of fluid entering a region is equal to the amount existing, meaning there is no creation or loss of mass within the system. The Navier-Stokes equation we use to describe the motion of fluid such as blood flow through the tissue by considering force like pressure, viscosity, and any external force acting on the fluid. So the energy equation is used to model how heat is transferred through the tissue. It accounts for heat conduction, fluid movement, and heat generated within the body such as through metabolism. The finished bioheat equation is used specifically focused on heat transfer in biological tissue, including the influence of blood flow and metabolism, heat generation, as well as how the tissue temperature change over time.
So we proceed to next parts of our presentation, which is the result of the grid independency test, GIT. The GIT was performed to ensure that the simulation results were not influenced by the mesh density, which is crucial for confirming the reliability and accuracy of the model. Various mesh densities were tested for both the 2 cm and 4 cm tumor models, and the resulting temperature distribution were compared. The findings showed that the temperature values remain constant even when the mesh was refined further. This demonstrates that the selected mesh density was sufficient and the results were independent of the mesh size. In conclusion, the GIT achieved assurance that the simulation was stable and the result could be trusted for evaluating the hyperthermia treatment. So we will proceed to the next slides of the result, which is the result of heat propagation in one tumor. So the figure of the left is 2 cm of one tumor, and right is the figure of 4 cm of one tumor. So the heat propagation in a single tumor was analyzed for 2 tumor size, which is 2 cm and 4 cm, under 3 target temperatures, which is 40 degrees Celsius, 45 degrees Celsius, and the last one is for 50 degrees Celsius. The results show that as the input temperature increased, the heat radiated outward from the tumor core into the surrounding tissue. For the 2 cm tumor, the heat distribution was more uniform, with the temperature retaining its consistency throughout the tumor. In contrast, the 4 cm tumor exhibit a greater loss of heat to the surrounding tissue, resulting in less uniform temperature distribution and lower core temperatures. This indicates that larger tumors require more power or longer treatment times to achieve even heat distribution, making tumor size a significant factor in hyperthermotherapy effectiveness. So, the next slides show the heat propagation results in tree tumor. So the left one is 2 cm of tree tumor and right one shows the 4 cm of the tree tumor. So the heat distribution in a configuration of the 3 tumors each with 2 cm and 4 cm diameters was studied at 3 target temperatures, seems like one tumor, which is the 40 degrees Celsius, 45 degrees Celsius, and the last one is 50 degrees Celsius. For the 2 cm tumors, the heat zones from each tumor merge, creating a more uniform thermal field. This overlap allowed for a continuous high temperature region. However, with the 4 cm tumors, the heat zones were more distinct and did not overlap as much, resulting in uneven heating. Larger tumors exhibit greater internal heat transfer resistance, causing more localized heating and heat dissipation into the surrounding tissue. This finding emphasizes the importance of tumor size and arrangement, as they significantly impact heat distribution during hyperthermia treatment. So we go to the last parts of our presentation, which is the conclusion. So overall, the study successfully demonstrated the use of computational fluid dynamics, which is CFD, to analyze heat propagation in tumor tissues during hyperthermia treatment. These simulations, which considered different tumor size and configuration, revealed that both tumor size and arrangement significantly affect heat distribution. Smaller tumors exhibit more uniform heating, while larger tumors require more power and longer exposure times for even heat distribution. The results highlight the importance of carefully selecting thermal input parameters based on tumor characteristics to ensure optimal treatment and minimize damage to surrounding healthy tissue. Overall, CFD proved to be an effective tool for optimizing hyperthermia therapy, allowing for better treatment planning and improvement patient outcomes. That's all from our Group 1. Thank you.